alabanza. Adoración.
Yo sé que tú mueves montañas.
Pop.
Eres el amor de vida, eres sanidad divina, tu nombre es.
Música urbana.
Y es que no entiendo, cómo es que no puedo verte y me sigues viendo.
Tropical latino.
Que por amor yo soy perdonado, que por amor yo salvo soy.
Toda la música que te gusta, escúchala aquí. Aquí, en Aliento Radio. Aliento Radio. Siente, respira, vive. Estas son las redes sociales oficiales de Aliento Radio. Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube. Encuéntranos como @Aliento Radio Oficial. Aliento Radio Oficial.
Welcome to another podcast of Avatar Home Health and Hospice. My name is Felix Cannibal, and today we're going to talk about something that confuses a lot of people. We're going to talk about palliative care versus hospice care. Of course, we'll also talk a little bit about our agency and all the other services that we provide. So, to start with, Avatar Home Health and Hospice was founded back in 2006. So, we've been in business for quite a long time. And what we do is we do home health, we do hospice, we do palliative care, and also provider or caretaker services. So, to go and give you a very short explanation of what each of those services do is, for instance, in home health, that's when a patient has been discharged from the hospital, or they go to the doctor and the doctor believes that they need extra help at home. And we send out a nurse to make sure they're taking the medications right. Or if they have a wound care, we take care of the wound care. We take care of if they need a physical therapy, occupational therapist, somebody to help them take a bath and do some of their daily activities. So in a nutshell, that's what home health does. Hospice is for a person or a patient with a terminal illness for which the doctor has determined that there's nothing else they can do for them. So if the doctor, say a patient with cancer, and they've been through chemo and they've been through radiation, and it gets to the point where the doctor knows that going through more treatment is not going to help that patient. That no matter what they do or don't do, the patient is going to pass in approximately 6 months, plus or minus. So at that point, that patient should really be in hospice care. And of course, that's a big decision. Normally it takes the doctor, the family, the patient, and ourselves, and after some consultations and questions and answers, hopefully the patient will let us take care of them with hospice care, which, by the way, it happens at the patient's home. Then we have also caretaker services or provider services, and those services are those that are not clinical. That's when the patient only needs someone to help them with their daily activities, such as preparing a light meal, going grocery shopping, taking a bath, obviously, light cleaning, light meal preparation, something like that. And then lastly is palliative care, which is basically one or actually the last service that has come upon the healthcare services. So about 10, 15 years ago, some doctors started what is called palliative care. So what is palliative care? Palliative care is for someone, a patient that has a chronic illness, and they basically need pain management. So if the patient, in order to avoid or to keep the patient from having to go to the doctor's office every other week or once a month or so on, what happens with palliative care is that the doctor is going to visit the patient at home, again, once a month, once every 2 weeks or so, making sure that they're taking the right medications, maybe adjusting or changing some of the medications they're taking, but primarily that is for pain management. Now, keep in mind that the difference between a patient in hospice and a patient in palliative care is that the patient in hospice, even though they might need pain management also, that patient is already, the patient already knows, and we know that the patient is not going to be with us for a long period of time. In the case of the palliative care patient, even though they might have a chronic illness that could qualify for hospice, such as Alzheimer's or dementia, or even, heart problems, or even cancer, the patient needs the doctor to visit them, but they really are not going to die anytime soon. So a palliative care patient could be around for another 10 years, 15 years. However, when you look at palliative care, it only includes the doctor, a visiting doctor every week or every 2 weeks, or a month, depending on the needs of the patient. However, most of the times, or maybe I could say all the time, a patient in palliative care is going to need more help. They're going to need a nurse to visit them. They're going to need a CNA, which is a nurse's assistant, to help them take a bath and keep the area where they're living clean, maybe change the linen in their beds. And they might even need therapy, maybe occupational therapy, physical therapy, or speech therapy. Therefore, the palliative care is not going to be enough. So when that happens, the palliative care, called the doctor of palliative care, will call a home health agency and have the two services supplement each other or complement each other. So the doctor takes care of the medications, the home health care takes care of everything else. Now, many people think, or what happens is that there are people that really should be in hospice care that they're not ready. In other words, they cannot accept the fact. Sometimes, most of the times it's the family, not the patient. But many times the family cannot accept the fact that their loving mother or father or husband or wife is going to pass soon or in the near future. So they try to hold on by saying, well, let's put him on palliative care because I don't think that my husband or my dad or whoever it is going to pass anytime soon. Even though the doctor that's been treating that patient for months or for years, that doctor, after reviewing the patient's chart and doing all the testing that they do and having given that patient all the treatment that they could give him, even though the doctor is the one saying the patient is going to die approximately 6 months or less, the family cannot accept it. So in those cases, what people are doing nowadays is say, well, let us have palliative care. Not understanding that palliative care and hospice have completely different reasons to be provided. In palliative care, we're looking for a patient, or we're taking care of a patient that's going to be with us for years. We're in hospice, we're taking care of a patient that's going to be with us for maybe a few months. So it's really, when a patient that should be in hospice goes into palliative care, we're really doing that patient a disservice. Why? Because palliative care is not designed for somebody who is going to die relatively soon. However, there's something called the rights of a patient, which is we have to respect. So the patient should have the last word in what kind of care they want, who is going to be their doctor, who's going to be their home health agency, who's going to be their hospice agency. And we do respect that at Avatar Home Health and Hospice. Actually, the patient is our main concern, so we actually listen more to the patient than we do listen sometimes to the doctor. I mean, I shouldn't have said that, but that's the way it is. So if the doctor says something and the patient says something else, we really need to listen to that patient and go back to the doctor and say, doctor, the patient calls us, and we do have to advocate for the patient. So, having said that, if the patient and their family, or his and her family, chooses for us to do palliative care, we're going to do palliative care with the hope, if that patient is not a palliative care patient, but actually a hospice patient, we're doing palliative care with the hope that after a couple of weeks, when they see that the patient is really declining, the family and the patient come to understand that palliative care is not for them. So, again, it's two different philosophies. Keep in mind, one, we're treating the patient to leave us in a relatively short time. In the other one, we're treating the patient like he's going to be with us for many, many, many years. So why is it so important to know that? Because when a patient goes in hospice, not only do we take care of the patient, but we look at the family, the caretakers. How can we help the caretaker? That's something that, even though we care about the caretaker in palliative care also, there's no services that we can provide for them. So in hospice, let's say the caretaker is overwhelmed, because if you have ever taken care of somebody 24/7, you know that that's very, very consuming. That gets you tired. Sometimes you're overwhelmed and you're taking care of somebody you love, so you don't want to ask for help, but it gets to the point where you have to ask for help. And then we can help you in hospice by giving you what is called respite. So what is respite? So we say to the caretaker, would you like to have 5 days off where you don't have to take care of your husband or mom or dad? So they say yes. We go ahead and we arrange for that patient to go into an assisted living facility for 5 days. And we take care of the patient in that assisted living facilities, and we pay for all the expenses. So that way the caretaker can go for a weekend someplace, or just relax for 5 days without having to get up at 3 o'clock in the morning to give the patient medications. So we also provide the patient in hospice with a chaplain. And that chaplain is to help the patient in his or her spiritual needs. So even if they're not religious, the chaplain is trained to be like a sounding board, so the patient can talk to the chaplain. The chaplain can talk and make the patient more comfortable and more accepting of what is coming. And then we have the social worker. And the social worker is going to work with the hospice patient, make sure that all his final arrangements are made. And then when I say the patient, I'm saying the patient and the family. And in many cases, the patient is not able to make decisions for themselves. So we have to be dealing with the family. So we make sure they have all the final arrangements made. If they need an advance directive, and I'll go on in another podcast, I will go into what that is. So any documentation that the patient needs, the social worker will help with. And also, if the patient needs any assistance that are not covered under hospice, the social worker might look outside to state or county agencies for them to provide those services to the patient. So again, there's a big difference between the two services. And if you need hospice services, if your doctor tells you you need hospice services, if the doctor tells you your mother needs hospice services, by all means, think of the quality of life that the patient is living, and do not make that patient be in palliative care when they should really be in hospice care. And we'll be the first ones to tell you, if the patient doesn't belong in hospice care, we will tell you this patient is not appropriate to be in hospice care. And we have to do that, number one, because in hospice care, the agency is paying for all the expenses. Now, we're going to be reimbursed, don't get me wrong. But if we accept a patient in hospice that is not really going to die soon, and we do that often enough, Medicare will come back and will say to us, you had all these patients in hospice that they should have not been in hospice, so give us all that money back. And they will take the money back from us. So that's why it's so important that you deal with an agency that is ethical and that has proven itself to be in the higher standards than most of the other agencies in Houston. To give you an idea, we're not only Medicare and Medicaid certified, but Avatar Home Health and Hospice has received the Gold Seal of Approval from an entity called the Joint Commission. And if you see your doctor, ask him, who is the Joint Commission? And they will tell you that is one of the highest accreditations that anyone in the healthcare business can obtain, whether it's a doctor, a hospital, or in our case, a hospice and home health agency. So when you're dealing with Avatar Home Health and Hospice, you're dealing with a family business. I started this agency with my daughter back in 2006. My daughter is a registered nurse for many, many, many years. We advocate for the patient. With us, the patient is always first. And we make sure that the patient does not have to pay us anything when it comes for home health or hospice. If the patient is over 65 years of age, they have Medicare or Medicaid, they're not going to pay us anything. We're going to be reimbursed either by their insurance company or by Medicare. So that's something else you need to think about. 0 out-of-pocket expenses. A treatment, we're going to treat your loved one or yourself as if you were a member of our family. And you can go into Google. You can check our Google reviews, and you're gonna see how many patients have said wonderful things about our nurses. Actually, I have had meetings with patients. I meet every single patient, and right now we have close to 500 patients, and every single one of those families have my cell number and my daughter's cell number. So ask yourself, what business do you know of where the owners of the business give you their cell number, their personal cell number? I only have one cell phone. That's where my daughter, my grandkids, my wife call me. And you're gonna have that number too. And I tell you, you can call me 24/7. If you're not happy with the services that Avatar Home Health and Hospice provides you with, you call me and I'll take care of it in less than 5 minutes. So think about those things when you're choosing a home health or a hospice agency. Right now, in order to be able to take care of those 500 patients, we employ 150 members of our staff. And among those members, we have doctors, we have chaplains, social workers, many nurses, many assistant nurses, an untold number of physical, occupational, and speech therapists. Our staff in the office is about 22 to 25 people, depending on the day. We have so many trained and caring personnel to take care of you or your loved one that you will not go. If you're with Avatar Home Health and Hospice, I guarantee you're gonna be very well taken care of. So remember that. Now, since I talk about my phone number, let me give it to you. My number is 281-703-8050. That is 281-703-8050. And also you can look into our webpage, which is avatarhomehealthcare.com, avatarhomehealthcare.com. And in our webpage, we'll tell you about all our services. We introduce you to a couple of our staff. You get all the information you need, and that will help you get more familiar with our agency. So remember, for home health, hospice, palliative care, or caretaker services, we're here to help you. If you have any questions, if you have any comments, even if it doesn't have to do with home health and hospice, you have questions about insurance, like at the Advantage plans for senior citizens. You have questions about home groups or assisted living facilities, or any of these, anything related to the care of someone who's 65 or older, you can call me. You know, I've been in this business and in the insurance business for over 40 years. So if you have a question, most likely I will be able to either give you the answer to your question or point you to the right direction so you can get your answer. So remember, my name is Felix Cannibal. I'm with Avatar Home Health and Hospice, and look for our podcasts and social media shorts in most of the social media outlets. And of course, you can look, we'll be posting this podcast in YouTube, and also in Aliento Radio, where you can come in and you can log into Aliento Radio and get all our podcasts from the past. So once again, I want to thank you for listening and tuning in. I will be talking to you again about a different topic soon. So please take good care of yourself. If you have any questions, call me, and have a blessed day.
Estas son las redes sociales oficiales de Aliento Radio: Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube. Encuéntranos como @Aliento Radio Oficial. Aliento Radio Oficial. Estas